HIV rapid HIV rapid test oral quick. The table of contents, descriptive epidemiology, national incident and prevalence rate, local incident prevalence rate for Mississippi, national history of HIV, the purpose of screening, the level of prevention, HIV rapid testing, oral quick, characteristics, oral quick, strength and weakness of oral quick ethnical considerations, final thoughts, and my reference. Descriptive epidemiology. HIV and AIDS is a very sensitive topic to discuss, and the challenges are represented at both federal and local levels. Human immunity deficiency, better known as HIV, and acquired immune deficiency syndrome, better known as AIDS, ranks number 6 of the deadliest disease that exists today. The HIV virus weakens the immune system and can lead to the acquired immunity syndrome, which is AIDS. Unfortunately for Columbus, the disease in its entirety holds a huge stigma and a negative due to ignorance. If an individual admits to being HIV positive, the other person demeanor changes as if it was the plague. Descriptive epidemiology continuance. People in Columbus, Mississippi are not willing to talk about HIV AIDS openly. By not talking about HIV AIDS openly is a major reason why so many people won't get tested in fear of a positive test result. Therefore, people are infected with the virus continue to pass it to others for years before realizing their condition. This community health presentation is designed to bring about awareness, reduce the stigma, and reduce the spread of new cases of HIV/AIDS in Columbus, Mississippi. The population of interest are African American, bisexual, and gay men between the ages of 20 to 29 years old, with women being a secondary source of information. The national incidence and prevalence rate of HIV and AIDS. An estimated 1.2 million people in the United States were living with HIV at the end of 2013, the most recent years for which this information is available. Of those people, about 13% or 1 in 8 did not know they were infected. In 2015, 39,513 people were diagnosed with the HIV infection in the United States. Gay and bisexual male accounts for 82% of HIV diagnosed among males and 67% of all diagnoses. Heterosexual contact accounts for 24% of HIV diagnosed. Women accounts for 19% of HIV diagnoses. African American represent 12% of the U.S. population, but accounts for 45% of HIV diagnosis. Hispanics, Latinos represent about 18% of the U.S. population, but accounts for 24% of HIV diagnosis. Local incident prevalence rate for Mississippi on HIV. In Mississippi, the number of people living with diagnosed HIV in 2013 was 9,036 individuals. Rates of people living with diagnosed HIV in 2013 per 100 people was 367 individuals. 68% of people living with diagnosed HIV in 2013 were men and 32% were women. 73% of the people living with diagnosed HIV in 2013 were Black, 3% Hispanic Latinos, and 20% white. The rate of Black males living with an HIV diagnosis is 5.3 times of white males. The rate of Black females living with an HIV diagnosis is 9.7 times that of white females. Natural history of HIV. Today, human immunity deficient virus, better known as HIV, is one of the largest epidemics in the world. HIV is the same virus that can lead to the acquired immunity syndrome known as AIDS. Researchers found in Researchers found the earliest case of HIV in a blood sample of a man from the Democratic Republic of Congo. It's said that the virus spread from bush meat trading while hunting chimpanzees. Hunters would come in contact with animal blood. Natural history continues. Before the 1980s, researchers estimated that about 100,000 to 300,000 people were infected with HIV. The earliest cases was confirmed in 1968 by Robin Rayford, a 16-year-old teenager who never left the Midwest or received a blood transfusion. This suggests that the AIDS and HIV may have been present in the United States before 1966. But before AIDS was identified, the disease appeared as other immunity conditions like pneumocystis, pneumonia. A year after scientists identified AIDS, they discovered the cause of HIV. The purpose of screening for HIV is to determine if an individual has HIV. Knowing the HIV status gives an individual power information for treatment and counseling. Early testing allows for early treatment, which ensures a longer and healthier life. Knowing your status can help you prevent AIDS by decreasing transmission. HIV testing can reverse the AIDS epidemic through global treatment program and advocacy. The levels of prevention. Prevention, also known as intervention, are utilized for reducing risk or threats to health. Primary prevention process of preventing disease or injuries before it occurs. Secondary preventions process or reduce the impact of a disease or injury that has already occurred. Tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effect. Or HIV rapid test oral. Oral Quick is the first FDA-approved oral swab in-home test for HIV, which does not require blood. It detects antibodies to HIV type 1 and HIV type 2, the viruses that causes AIDS. HIV is appropriate for screening because there is a large group of people who are infected and don't know it. And even if they are engaged in behavior that would put them at risk of getting HIV, they may be reluctant to visit their doctor or a healthcare facility to be tested. Characteristics of Oral Quick. Results are obtained in 20 to 40 minutes. An individual can test themselves in private. Clinical studies have shown that oral quick screening test has an expectancy performance of approximately 92% test sensitivity, the percentage of results that will be positive when HIV is present. Also, clinical studies shown that oral quick in-home test has an expectancy performance of 99.98 for test specificity, the percentage of results that will be negative when the HIV is not present. An individual test positive will need a follow-up test from professional medical personnel. Oral Quick offers free counseling for positive HIV results. Strength and weakness of Oral Quick. Oral Quick tests can be performed by non-medical personnel, can be self-administered by individual in their own home. The test is portable and the results are available in 20 to 40 minutes. The test has the potential of identifying large numbers of previous undiagnosed HIV infection. Individuals who receive results at point of testing will receive results at point of testing. Oral Quick is less sensitive for early HIV testing. Oral Quick uses oral fluids which have lower antibody concentration and are less sensitive and specific that when blood is in use. Oral Quick ethical consideration. Confidentiality and privacy of tests will not be controlled. Individuals testing positive will not be identified by medical personnel and treatment may not be given. Tests conducted without the informed consent of individuals. The test may not find antibodies and give a false negative result. Therefore, mandatory follow-up should be required. Oral fluid and infection later after exposures than do blood tests. 1 in 12 people may receive a false negative result with the test. Recommendation for new exposure and high-risk individuals to require laboratory blood tests for HIV detection and accuracy. Final thoughts. The purpose of the presentation is to encourage more people to get tested for HIV and know their status. Still, for some people, it may be too late. With the use of rapid tests or quick, the HIV virus decreases the number of new cases of HIV among gay and bisexual African American men in Columbus. This will also bring about awareness to seriousness of the disease and understanding the overarching issues that are involved when left untreated.